name is Dr. Obi-Wan Kenobi, and I'm here to teach you guys about episiotomies. Very exciting stuff. Let's come on over to my board over here. So episiotomies are a surgical incision of the perineal body to open up the outlet of the birth canal. As you can see, there's various types of episiotomies that can result in various degrees of laceration. What we want to do is avoid these degrees of laceration. Usually there's a midline incision from the perineum downwards, or you can have a mid-lateral incision downwards and slightly to the left or right at 45-degree angles. So, additional complications that are associated with the episiotomy are blood loss, infection, pain, and perineal discomfort. Usually, if a patient has a large prima gravida, has a baby that's large for gestational age, or has a forceps or vacuum, has a forceps or vacuum delivery, that can be increased risk for episiotomy. Usually the procedure is done with a pair of sharp scissors doing the midline or mid-lateral incision, as I said before. And it can be done without anesthesia in an emergency, but most of the time it's done with anesthesia or local anesthesia. Well, I think I have my first patient of the day. I'm going to go see them if you want to come along. I'm very busy and important. Better practice hand hygiene. Hi, how are you doing? She's dead.
Oh.
Hello. Hi.
Hi.
I'm Dr. Kenobi. It's good to meet you. Good to meet you. What's your name?
I'm Alexandra.
Hi, Alexandra.
Mariana.
Hi, Mariana. It's a pleasure. Okay. So, this is one of our consultations for your pregnancy. We have you at about 35 weeks right now.
Yes.
And I hear you had some questions.
Yes. So my friend told me when she was having her baby, she had a horrible tear. And so ever since she told me about it, I couldn't sleep at night. I'm just so worried that it's going to happen to me.
So in that case, to prevent a tear, say you had a baby that's large for gestational age, or you had some other complication, we could do what's called an episiotomy. And we actually make a little laceration in the perineum to prevent you from ripping, okay?
Well, is that going to hurt?
Oh yeah, it's definitely gonna hurt. Oh, hold on. I have to go to the birthplace. I have to send my nurse in, but it's been nice to meet you. Nice to meet you too. Yeah, bye-bye. Very busy and important.
It's going to hurt.
The doctor just left.
Yeah.
Hey guys.
Hi.
Good to see you again. Hi, I don't think I've met your wife.
No, my
Nice
name's
to meet
Mariana.
you. I'm Jessica. All right, so you guys had some questions, right? I know Dr. Kenobi had to leave, so what we need to do is just find out what questions you have. I can get them, if I can answer them, I will, but if I can get them over to Dr. Kenobi, then we'll do that too.
Okay, he just mentioned as they ran out the room that there was going to be pain.
Yeah.
A lot of pain with the episiotomy.
Okay, so she talked to you about what the pain is, right?
No.
Okay, all right. So the idea behind it is that this is a very normal thing that happens. We prevent it as much as we can, and then we make ourselves aware of what the risk factors are, and then we make a plan for it if it happens. Is it going to be painful afterwards? You're having a baby, okay? So you're going to have some discomfort, but we're going to plan for that. And if we have a plan in place, then we can take care of it, right? Okay. So I'm going to leave you guys with this pamphlet that goes over what episiotomies are and how we're going to take care of it when that happens. But specifically, the first thing that we're going to do is not rush everything. We're going to take our time and let your baby do what your baby does best. Okay, so first of all, we're not going to rush anything. Second of all, we're going to keep everything clean. So By doing that, we're going to cut down any risk for infection. And it's typically, if you get an infection afterwards, you have a little bit more discomfort. But if we take care of that ahead of time, then we shouldn't have an issue, okay? Let's see, what else? Afterwards, what we're going to do is, or actually beforehand, we'll do a perineal massage. So what we'll be doing is just looking and seeing how your baby's coming down. And then we'll kind of rub the area. If we can do some stretching, that's kind of like yoga down there, right? So if we stretch everything out and kind of prepare everything, then your baby has like a soft landing, you know? And then if we see an issue where it's going to be your baby's big and we have to do a little laceration of some sort, or not a laceration, the episiotomy, where we make an incision, that tends to do really well because then we kind of see it coming and then we don't have a bigger tear than what needs to happen, okay? And so Dr. Kenobi will go over all of that stuff with you later on before we do everything else. So let's say, worst case scenario, we have to do it, which is a procedure that we do all the time, you know, just a little repair. Afterwards, we would do sitz bath, where we get you like in a warm area, we keep everything comfortable. Right. We use cortisone cream, a witch hazel cream even, that helps you feel a little bit better. We've got some nice gel packs and ice packs. But just at the end of the day, you're creating human life. So sometimes that's not easy, but if we have a plan for it, we can take care of it. If we have to, we can do like some Motrin or some like numbing cream or whatever, you know, we'll use all of that. And then surprisingly, and this is just to tell you because I don't want you to be shocked afterwards, we get you up and moving around afterwards. So we'll be watching you and making sure everybody's healthy, everything is safe. But what we want to do is kind of get your body back to, you know, moving around, get blood flow going, get you healing. The best thing is that if you have the episiotomy or a laceration that we have to repair, we don't have to keep you separated from baby, okay? So you will have your baby with you afterwards and you should be doing just fine. We'll take care of that. The pain afterwards, if it was an emergency situation, right, and we didn't have time to get you numb, then we would close the area up because it's very important that we don't let you bleed, okay? So, but we would plan for that. The idea is to make a plan, have you numb, because I think you've consented for, we're doing the epidural, I believe, right?
Yes. We don't have any pain, no pain.
Got it, okay. So we're doing the epidural. So, all right, what we're gonna do then is get some consent forms going.
Okay.
All right.
Also, we have one more concern.
Yeah.
So, part of my culture, and she's willing to go along with me.
Sure.
For tradition's
Marriage.
sake. Yes, compromise. And so I don't know if she's going to have a diet restriction, but we really need her to eat like hot foods and hot beverages instead of ice chips.
Okay, good to know because we normally do ice water, so we'll do hot water. Anything else we can do to make you guys comfortable while you're here?
That's it. You really answered all of our questions.
Okay, all right. If you guys think of anything else, we'll come back to it. But meanwhile, we have a consent form here, so I will have you just sign off that this is the goal, and we'll make a plan, and we'll be talking a lot. Okay, you guys know that it's every week now until baby's due, right?
Yes.
All right.
Okay, so let's ask our prospective parents here what they learned today. Guys, can you tell us in a return demonstration, can you explain the procedure of episiotomy?
Okay, so in an emergency situation, you wouldn't be numbed, but we hope to plan this out and be numbed. And then there's 1st degree to 4th degree tears, and it can either be a medial episiotomy or a medial lateral episiotomy.
Just 45 degree.
That's right. And yes, so.
And what happens after you get an episiotomy? What do you do for care?
You would ambulate the patient right away, and a sitz bath would help.
The massage. She's going to massage, and we're going to take it slow.
Yes.
Okay. We are so happy to have provided this care today at Death Star Incorporated. We wish you guys the very best.
Thank you.
Thank you.
Episiotomies.